At 6, we told you about Vivitrol, a drug that actually blocks the brain's receptors for opiates and turns off an addict's urge to use heroin.
It's a fairly new drug, and patients only have to endure a monthly injection instead of a daily dose. Sauk Prairie is one of a number of communities starting to offer the drug to those in recovery.
And tonight, Danica Lewis tells us what has made it so successful. Danica?
Well, Eric and Michelle, it's where they start this that is crucial. The jail. The CARE program officially started a year ago in Sauk Prairie, a collaborative bringing together law enforcement, doctors, attorneys, teachers, businesses, you name it. If they can provide help, they're at the table. And Adele Mack is one of the dozens who got the chance to get back on the horse, so to speak.
15.
Spring is a season for resets.
Still young at heart.
Clear skies and a clear mind.
This is my serenity. This is how I keep myself grounded and stay focused.
For Adele Mack, freedom is as simple as a saddle.
It's seriously the one thing that I have that is my escape from everything.
It's an escape she surrendered for years, trapped by addiction.
I started my first use when I was 13.
From hallucinogens to party drugs, alcohol, crack, and finally,
I took it into my arms, and then every day after that, for 2 years, heroin took me. Heaven and hell all at the exact same time.
The girl with high honors from a good family stopped riding her horse in the fall of 2012.
People don't think that it could happen to a girl like me.
Adele overdosed a week later.
You're always chasing that initial high, and you never get that first high ever again. And it becomes not so much even enjoying the drug anymore, it's keeping yourself not sick. And you'll do anything not to feel that way.
She found herself in a Sauk County cell. Then, near the end of her year behind bars, Adele found out she was going to be an aunt.
And that was the moment that I knew it was over. I knew that no matter what, I had to keep pushing on because I was never not going to be a part of my nephew's life.
I was shocked, to put it mildly. It would never happen in my family.
When Joan Mack thought drug user,
I had a stereotype person that I had in mind, and it's nothing like that at all.
That stereotype was shattered when she was forced to find help for her own granddaughter.
Where do I turn? I didn't know where to turn, where to get help.
With the help of St. Vincent de Paul, Joan spearheads the CARE program, giving users access to counseling, education, job training, and Vivitrol, an injection that biologically blocks the urge to use heroin. And according to Joan, a drug that kickstarts a clean life, starting in the Sauk County Jail.
All of these things that are working together to help these people get a new lease on life.
My sobriety date is in the middle.
Adele got her first Vivitrol shot while serving her sentence.
My recovery is a gift, and I'm grateful for it every day.
Since her release, she says she's religious about her meetings and surrounded by support.
I'm so proud. I'm so proud.
And after riding to hell and back, Adele is finally free to live and love again.
I learned how to live sober and to love my life sober.
Congratulations to Adele. She was on Vivitrol for 3 months thanks to the CARE program. CARE also helps heroin users secure health insurance, while Vivitrol runs up to $1,200 per shot each month. Medicaid and Badger Care do cover it.
Danica, do we know if this drug is available anywhere else?
Yeah, it actually is, but through different means. So, for instance, in Dane County, Vivitrol isn't offered to inmates, but Journey Mental Health connects with people in jail and can get them the drug once they're released and evaluated. Like in Sauk County, they've seen huge success with Vivitrol. Nearly all of those who receive the injection and treatment under their opiate recovery program have a job and stable housing. And the state is actually looking at replicating Sauk County's CARE program across Wisconsin.
Could be a huge answer for addicts out there. Danica, thank you very much.
Sure.